Welcome, everyone, to the La Jolla Cosmetic Podcast. I'm your hostess, Monique Ramsey. And today on the podcast, I have a mother-daughter duo, and I'm super excited about this. So I have Alexis, who's a patient of Dr. Swistun and had her dream procedures done, and then her mother, Regina. And we actually have another episode about her that you'll have to listen to. And she also had some wonderful little procedures by Dr. Swistun. And so it's kind of fun to have a mother-daughter duo and talk about why and how that, how that relationship was during surgery and with each other's surgery. So welcome.
Thank you. Hi, thank you.
Yeah. So let's start with you, Alexis. Start by telling us the procedures you had, and you sort of had an extra step before you came to have surgery, and tell us about that.
Yeah, so I met with Dr. Swistun and I told him that I was currently taking Wegovy. So I was planning on trying to lose all that baby weight and the COVID weight before I had some procedures done. And then after, I think it was about 9 months, then I felt like I was ready to go. And I had a tummy tuck along with 360 lipo, brachioplasty, which was actually something that I had wanted pretty much my whole life. And then, since I was there, just a little bit under the chin taken out just to, define my face shape a bit.
Mm-hmm. And so for the people in the audience, if you haven't heard of a brachioplasty, it's an arm lift. And normally the scars are kind of between your armpit and your elbow because it's that extra, that little extra that if you're shaking the pom-pom at the football game and it wiggles or waggles, sometimes it's just extra skin, not necessarily fat. So tell us about your weight loss journey a little bit, because we do the skinny shot at the center, and a lot of people kind of do want maybe a body contouring procedure like a mommy makeover, but maybe they're not quite at their weight and they wouldn't have the best result. And so a lot of times the doctors want to get you as close to that weight as you can get. So tell us about that journey a little bit.
Yeah, so I find that drug just absolutely amazing. I kind of always was someone who struggled with my weight. I was never the small little cheerleader, it's in high school or anything. I was always kind of the taller, bigger girl. And so, when my doctor said this could be an option for you, I started it, and, the results were pretty much almost immediate. I think I averaged about 1 or 2 pounds a week on it. So the weight loss was very obvious, very clear, very fast. And, I really didn't find it that big of an imposition, just 1 shot a week, a little bit of maybe nausea and tiredness, just like that night that I take it, but the rest of the week, just fine. And it's really incredible how it really the idea of I'll go eat a little snack, or, I could, use a little treat, that noise in your head just kind of just quiets down a lot. Like you eat your meals, but they're much smaller, because you can really feel your body telling you, we're full, we don't need any more.
Mm-hmm. And how long before you had your consult or your surgery, and how much weight had you lost at that point?
So when I had my consult, so I got Wegovy with insurance, and there's a couple steps you have to go through before you can get insurance to approve it. Because, at the time there wasn't really any med spas offering it. It was, through insurance or through through your doctor, or not at all. And so first I was on an initial drug and to prove that I could lose the weight. And so I lost about 20 pounds on that drug. Then it got into the Wegovy shortage, so I kind of had to wait until it was back in stock. So it took about 6 to 7 months. And between the 20 pounds and the Wegovy weight before I came back to have another consult with Dr. Swistun, I was at around, I want to say 70 or 75 pounds.
Wow. Huge difference. Difference. So, and you went from not even being a candidate yet to being a candidate, or did you have a consult first?
Yeah, so I had an initial consult, and he was like, we can start right now if you want, he's like, some people want to lose weight, some people want to just get it done now. It's really up to you. So I was like, let's wait and see what those drugs will do, and, what will happen with it. And I think I'm very glad I waited, because so I think it was like summer that we went in. And then when I came back, it was like spring, and everyone was like, oh my God, different person. Like, who are you? So then it was really good. And actually, so I went from having like the large liposuction designation to just a medium because of that, which saved me a little money, which was nice.
Right. Well, yeah. And I think it's less risky too.
Yeah.
The more you're closer to your weight, the way less chances for complications in a lot of different ways. And so, plus you'll just have a better result. So, okay, to your mother. So, Regina, so what were your initial thoughts when Alexis told you at first that she was thinking about having a cosmetic procedure, and especially because you had gone through it yourself?
To tell you the truth, I kind of was the one that really encouraged her, because I knew how unhappy she was with certain parts of her body, particularly her arms. And that was the major thing she was focusing on. And I was like, no, do it, do it, do it. And I told her, if you do it now, you'll enjoy it for the rest of your life.
I love this because this is what I've noticed myself by having certain procedures at certain ages, because then you enjoy it longer, but that's not the normal thought process. I'm going to be honest, Regina. A lot of people think, oh, I'm too young, or you're too young, or you don't need it. And you're exactly right. And isn't that nice, Alexis, that your mom would encourage you to yeah, go ahead and do it.
Speaking of like the normal thought process, I always had this idea that plastic surgery was something that really vain people do, or like celebrities, movie stars. I didn't know how common it was. It doesn't seem like it's something people share with each other. Because once, my mom had her procedure, and then we were talking about doing my procedure, all these people were like, oh yeah, I've had a tummy tuck. Oh yeah, I've had my eyes done. And I was like, well, I wish I would have known, because I would have thought of it earlier, maybe.
Right. Well, yeah, it is helpful to know that you're not out on an island by yourself, and your own thoughts about your body, or how, and it doesn't matter what anybody else thinks. It only matters what you think. But at the same time, it's kind of nice to know that you're not alone, and that there's other people in your friend group, or in your family with mom that, that have done it before. And it is normal. It really is. I mean, in the 36 years we've been around, we've got thousands and thousands and thousands of patients, and normal people. Just, it's not the celebrities. I'll never forget, we had a cement truck driver who came in, and she wanted a breast dog. That was her profession. I was like, oh, okay. Everybody does this. Literally everybody does this. So Regina, tell us about, you went first, right? And we have an episode about this. So we'll put it in the show notes so everybody can hear your full story, because it's a very interesting story. Very interesting. You had surgery at another place and had a complication. So tell us about why you initially came to La Jolla Cosmetic to fix that result.
Well, it turned out that after, I think it was at least 6 months or 8 months, I would look at myself in the mirror when I would be dressing. And every time I looked, I was like, oh, I had this tummy tuck fail. I just, I had some lumps, and then I had an infection in my incision. And there were 2 spots where that was visible. And then I had the side things that they call dog ears. And I just really would look at myself and was just unhappy. And I thought, and I went through a lot with my first surgery, health-wise. And then I just decided I just didn't want to look at myself like that, every day forever. And I would talk to some of my doctors. And one day I was here in this building at my endocrinologist, and in their office, they started talking about La Jolla Cosmetic Surgery. And I was just like, oh, and then they mentioned Dr. Swistun, and I was like, oh. So, I did my initial booking, and then Alexis actually came with me. We went to all our appointments together. So we almost had a double getting to know Dr. Swistun and La Jolla Cosmetic. And so that was really great. That gave us each very good confidence.
That's neat. So, okay. So Regina, you had surgery first, and I love that you both went to each other's appointments, because not that you need a person with you, but it really helps, because there's a lot of information, and you're getting to know the doctor, and you're getting to know the staff, and you're getting to thinking about that procedure in the first for the first time and maybe learning about it for the first time. There's so much to process and it's a little intimidating. And to have another person with you if you ask a question, is the doctor hearing your question the right way? And it's helpful to have a nurse there because they're making sure everybody's translating kind of the same, like the intent of the question. But even when you get home, it's like that other person who's with you can remind you of certain things that might have been said. And did you find that for each other? Alexis, did you find that helpful?
Yeah, a lot of my questions really were focused on like the more medical aspect of it because of my mom's initial experience. Like, I wanted to know, what do I look for? What issues should I be watching for? So it was good because then also I could carry all that information onto my own surgery as well. And it's also really nice in that you do get a bit overwhelmed when you're thinking about doing this. It's a big thing, and so sometimes things that you wanted to ask or should have asked, you might forget about, and then you're like, oh, I have to wait till the next one. But since the other person isn't in that same like mental state as you, they're a little more objective because they're not feeling that like pressure. Then they remember to ask those questions or to like come up with the questions that you're like, oh, I really should have asked that.
Right, right. Or if you don't remember something they told you, and then, and so what were kind of your initial thoughts, Regina, when you met Dr. Swistun, especially having been through a very negative experience
Yes.
from your first surgery with another doctor?
Well, it was like night and day personality difference. Dr. Swistun isn't what I would call typical plastic surgeon. He's very humble, is a really good word to describe him. He's not overly into himself. And actually, what he does is he's asking you, what do you want? And then he looks at you and says, this is what would be good for you. And you can tell that he really cares. And it's not about him and what he can do and how great he is. It's about what will make you feel better. What do you need to improve? And how can he help you? And I really was, I don't know, taken aback by the difference in personalities from my original doctor to Dr. Swistun. And so right away when I knew that, and Alexis was with me at that appointment too. And she said, oh yeah, Mom, he is just, really a good guy. He cares. And so both of us kind of fell in love, and that was the end of that.
we have a word for him.
Oh,
we have a name for him.
Do you? Okay, let's hear it.
So the first time we were there, there's a phrase for him. And then when the second appointment we had, as we were driving, and I was like, I hope he's still that. So there's a personality type called a cinnamon roll, where, they're just so sweet and warm and kind and nice. And so then I always call him a cinnamon roll because that's what he is.
I love that. I love that. Oh my gosh, that's the cutest thing. Yes, I love cinnamon rolls. So what's not, right? And I already love Dr. Swistun. But yet, I think, so Alexis, did you kind of have the same perception as your mom? And especially because I think you'd met, obviously, your mom's former doctor. So
Yes.
you also had the comparison. So what were your thoughts about Dr. Swistun besides the cinnamon roll?
Like starting with her first doctor, the first time I met him was when she was going into her appointment. And I was just immediately like, I don't vibe with this guy, to put it mildly. And so I was kind of like, I'm not going to have anything done because I'm not comfortable with this guy. I don't want to do, anything there. And so I was very, very apprehensive when going to meet Dr. Swistun because I was like, I'm really particular. And, I was like, if I'm not going to feel it, then I'm not going to do anything. But like, he is the best listener I think I have ever encountered. He asks you a question and he sits there and you can see him listening and letting you finish every thought that you might have in your head. And he absorbs it all. It's just really amazing.
I think you can pick up on fake.
Yeah.
Like in a millisecond, we can tell if somebody's being authentic. Whatever the cues are, who knows, but we know it. And so it seems like both of you kind of knew it.
Yeah, he's really like the most genuine person. Like, he He loves what he does. He is really invested in doing like the best possible job, not because like for his own ego, but because he wants you to be happy. He wants to see you come back with like a big smile on your face and, wearing all the pretty clothes and everything. That's what he's looking for.
Okay, so as a mother-daughter duo, how did you both support each other along your journeys? And I'll start with Regina.
Alexis was really great. And like I told you, she helped me with my first one. And, that was when I got septic and then went to the hospital. And so in the initial few days were very nerve-wracking for her. And finally, when she got me to the hospital, then I think she could relax. But then she was nervous in a different way because she didn't know the outcome.
Right.
The second surgery started. And again, she was taking care of me, spending the night and everything. But I think she was waiting for some symptoms or signs and nothing happened. And so I think each day she relaxed and, it got better. And so then after I was good, then it was her turn to do the surgery and we just kind of flipped. And I became the caregiver and she was the patient. So it actually really worked out. We were very supportive of each other.
I like that, and I think mother-daughter, husband, wife, best friends, it's like think about your support systems because really you don't have to go at it alone. And, some people like to hire a nurse and maybe if they're having really extensive procedures or, they live alone, but like think of the people in your life because it is so much better to feel like that you've got the support emotionally where, a nurse is wonderful because you have the support, you have the confidence, like in a nursing way, in a medical way, but you don't know them. And so I feel like if you can have a friend or you can have a family member or sister help you as long as they're good with it. I've seen, I have to say, it's the funniest thing. I've been in the OR or in the recovery room and where the husband or boyfriend comes to pick up the girl and from whatever she's had and like their eyes are like, you can tell like they're like, oh my God. And they're trying to like hear all the instructions and they're just like deer in the headlights, like, oh my gosh, what am I going to do? And in that case, if you don't think they can handle it, get a friend. Because, sometimes some men can handle it and or girls. But yeah, I think it must have felt really good that, if you're crabby and you're crabby to your mom or your mom's crabby to you, you love each other at the end of the day. Right. So were either of you nervous at any point, kind of going into your own surgery? Oh, Alexis is laughing. Okay, we'll start with you.
Let Alexis have that
one. I'm pretty high strung.
Really?
I'm a very nervous person.
Are you really? Okay.
Oh, yes. Yeah. I think on like the initial appointment with Dr. Swistun, I sat down and I'm like, so I'm going to cry a lot. Because that's how I process feelings. but yeah, so, it kind of just, I kind of put it out of my mind while on the Wegovy. It was just like, okay, that's like some, point in the future. You don't have to, think about it because there's no date on it. But then when I got that date of like when it was going to happen, it kind of like every day was like just inching a little bit more towards like, a total breakdown basically. And then once I was like in there, like sitting in the room waiting for, the nurse to come and just take me to the OR, the only thing going through my mind was like, you can just leave. Like, this is not like going to save your life or anything. Nobody's keeping you here. And it was like, it took everything in me to like sit and like not walk out the door.
Wow. Okay, but that's good to know that's, I mean, that's a valid feeling. And I bet you other people in the audience have had that feeling too. So I had that feeling with my first son and he was 8 days late and I wanted him the heck out of my body. And I got to the hospital to get induced and all that. I started bawling because as much as I wanted it, I was terrified of the whole thing. And I was like, what do I do? I can't do this, So all of us have that. And at some point, whether it's with cosmetic surgery or the dentist or pushing out a baby. So, okay. So you wanted to leave.
I did. And then my mom's like,
and your
"Just
mom's
relax."
like, no, sit down, sit
Yes.
down.
Yes. And then when she had to go, actually, the nurse was Rachel. And I looked at her and I'm like, "You're my mom now." Like,
Oh.
I was like, since my mom had to go, you're my mom for right now because I need someone in here to be my mom.
Oh, that's nice. And then nurses are so sweet. They're so
Yes.
nice and they have so much experience. And Regina, you and I talked about that on your podcast. Is that the experience level and knowing that like they've been there, done that and seen it, and they're going to give you the confidence to help you through it, whatever it is, whether it's emotionally, whatever. And they've, to answer the questions, all of it. So did anything surprise either of you throughout the process? And I'll start with you, Regina.
The only thing that actually surprised me was for myself how well it went, and then that Alexis got through it. And then once we knew that the hard time was over, and then actually the results for Alexis, it's better than what I could have expected. And I am so beyond happy for her. And every time I look at her, I'm really grateful to Dr. Swistun and that we found him, because she's become so happy. And, she has an adorable little daughter, of course, my granddaughter, but, she's just become a different woman. She's lighter, she's happier, she's more into how she looks. And Dr. Swistun gave her that gift, and I will never be able to forget that. So that was what surprised me, how wonderful she looks after all that.
Oh, are we going to cry? Are we all going to cry?
I think so.
Regina. Okay. So what about you, Alexis? Anything surprise you through the process?
I had a little bit of a joke and I don't really want to make it after that. Well, my big one was the location of one of my drains was very surprising for me because it was like in the back, right at my tailbone, which I was not expecting. But for me, like being more serious, like I'm really surprised at like how fast the recovery is. Like, not to say that it's not hard, but I was expecting like, oh, you're laid up for months, you can't do anything. And, by the end of the first week, I was going to the store like really slowly and everything and, being very careful, but I couldn't believe that I was like up walking around, getting in the car, going grocery shopping and everything. And then now when I think it's like I'm a little over 3 months out and I have like absolutely like no like real body restraints of like, oh, I had this big surgery like just that short amount of time ago.
Yeah, it is. I mean, you had extensive surgery because there's a lot of incisions.
Mm-hmm.
And so it's just a lot of stuff to heal.
Yeah.
And it is hard, but I think it's like the hardest part is usually the first couple days and just getting comfortable, And then it's like you can turn a corner. But I feel like there's an emotional part of it too. Like getting the drugs out of your system from the anesthesia and, kind of that hump of and swelling and bruising, depending on the procedure, can kind of max on the third day. But, we're all different. And I think the biggest thing is just no matter how good you feel, let your body heal because you can put yourself backwards. So, Alexis, for yours, did you feel like when did you kind of feel like you were turning a corner in your healing? How long into the healing?
So my surgery was on a Friday, and so I'd say by the next Friday, I was definitely feeling a lot better. Not wanting to sit like on the couch. I wanted to go out and do things. I got tired very quickly, and everything. But it's like mentally, I was like, I feel that I'm feeling better, and I want to be sure that I'm not just kind of like letting myself atrophy. And I had the energy and the like desire to go out and do things. And then by like the second week, other than, maybe struggling a little bit to get out of bed because of the tummy tuck, I felt like pretty normal, like, maybe a little more tired than I would have like, normally. But it's just really surprising how quickly I felt like it went.
Yeah, it's actually good to be moving a little bit, even if it's not a lot. Well, I love going back, Regina, to kind of your thoughts about Alexis and the surgery and her results. And when you were saying that, it made me think like it kind of Dr. Swistun helped bring out what was there inside, right?
Yeah.
It's like she
Right.
blossomed, and I'm
Right.
seeing her in this beautiful floral top. And as you were saying that, I was thinking that like she blossomed into the woman that she's supposed to be, and that was in there all along. And I think all of us, when whatever we have that's maybe holding us back, that we're not confident about, whether it's, our profile or the little stuff under the neck or the whatever, the arms, all the things that, it's like once you fix it, do you feel like then you can just go on your happy way, do your thing?
Like I said, for me, watching her, I mean, I was very happy with my results after Dr. Swistun did my revision. But watching Alexis and what happened with her and her increase in self-confidence, her increase in wanting to, wear makeup more and wear not prettier or sexier clothes, but you know what I mean? Just more tailored clothes, maybe. And that's just been really great to watch. And, and I'm just grateful every day that she has that. It's just the best thing ever. I couldn't get a better gift.
Oh, and look at you guys are going to be like out on the town together. You can, and slaying, as they say. So Alexis, what would your advice be to somebody who's considering the skinny shot, to get themselves to a goal for you, like yourself, or to get yourself to being, a better candidate for surgery?
I think a lot of it is like listening to your body. Like, it's very easy to kind of like overeat and then, give yourself like, kind of stomach problems when you're on the skinny shot because, your body is working differently. So, a lot of it was, being more cognizant and like eating more slowly, just drinking a lot more, making sure that I wasn't just kind of being mindless, like it's much easier to be, so there is a lot of, it's not just, oh, you take a shot and then, everything happens and it's great. There's a lot of just being sure you're paying attention and then, being sure you're staying active and everything. I walk with my mom every night, we
Oh,
we go
nice.
for about 4 miles. And
Oh,
so I think that
good.
really
Wow.
like contributed to helping the process go a little bit faster, maybe.
Yeah.
So it
Yeah.
really is you get out what you put in to
Mhm.
taking the shot. I think you can really maximize your results if you want to. And I think because you're seeing it happen so quickly and the numbers on the scale going down, it really keeps your motivation very, very high.
Absolutely. I can agree with that completely, because especially if you're somebody who's struggled with weight for a long time, you can try something, and if you don't see it working and you're putting in all this effort,
Yeah.
it's so frustrating. It's like, what's the point? And
Mhm.
where I agree with you that these shots are so different in the way that they work on your brain and help you not have all that food noise, and to the point where it's almost like a little bit of a habit when you eat more. And I remember really for months at the beginning having a hard time with portion control because I was used to putting a certain amount on my plate, or used to having 2 pieces of toast, not one, or it's
Mhm.
just certain things that you just do without thinking. And then you're like, oh, but don't I need that? Like I kept thinking, don't I need that? No, you don't.
Yeah.
but getting yourself kind of wrapped around a new lifestyle. And I love that, you do have to put in some work at it, but it is the easiest thing I've ever done, I have to say. But, having enough hydration, keeping exercise in there, eating enough protein. That's, I
Mhm.
think, that is for me sometimes one of the harder things to do, is to make sure I'm getting enough protein.
Yeah, the protein is hard because
Yeah,
you don't have that like an appetite, as you
right.
used to. So, you might have a couple bites, something small, and then you're like, well, but that's not a lot of protein that I just ate.
Yeah, yeah. So tell me a little bit about why the support system is important when you're getting cosmetic surgery. And I'll start with Regina.
Well, it's nice to know that somebody's backing what you want to do. And when you don't have that, if you have people discouraging you or saying, oh, maybe you shouldn't be doing this, maybe it's wrong, it's too expensive or whatever, it's kind of a downer. But if you have that support and somebody, and that person's going to be there and encouraging you to walk or encouraging you to watch what you're eating, or maybe not have that last French fry or whatever it is, it's pretty amazing. And to know that you can depend on them if you're not feeling good, or when you come home and they're there and they're watching you and they're making sure nothing bad is happening to you. It's really incredible to experience that.
And Alexis, I'll have the same question for you about a support system.
I think having someone that you can kind of unload those negative feelings that you're feeling at the certain time because, you're uncomfortable or you can't move very well right now, and knowing that they're not going to be like hold it against you, sometimes, my mom and I, we swapped, she unloaded on me when it was like her surgery, and then I could unload on her. And, because it is hard. The surgery, they give you that graph that shows like how your feelings will be with the surgery. And I definitely was like, that's not going to be me. I'm going to handle this. Like, I've got this. And like, I cannot tell you how accurate that graph was of like, you're going to get really low for a little bit. And, it's okay because then you're going to build yourself back up. But like to have somebody when you're at that really low point of like telling you, it's okay. You don't feel good now, but you're going to feel better soon.
Yeah. Because all of it, it's normal. It's so normal. The one thing that that graph shows, it's like right at the beginning, you're like, why did I do this? Right? I mean, even if that the graph says that, you're like, and then you're there. You're like, yesterday I was normal. I was fine. And today I can't even move. What have I done? Like totally normal. But you're right. Having somebody who's going to forgive you if you're crabby, right? It's, but having somebody, like I said, who's in that emotional like connection. And I think especially when, what you went through, Regina, in the first surgery, I mean, Alexis was invaluable because she took you to the ER. And
Yes,
when you stop having this office telling you things that when it's not making sense, and you finally are like, I got to make this call and we need to do this. And, having that trust, having that support system. I mean, you couldn't have been alone. And I don't know what day post-op that was for you when you ended up going.
It was about 4 or 5 days after when I was actually able to convince her to go. Like, she was just so far gone that she was telling me to go home. She was telling me I'm fine. I don't need anything. And I think I spent almost 2 hours like convincing her to get in the car to go to the ER.
Wow. I mean, because at day 4 or 5, most people, you have your friend there usually a day or two. And then you're like, okay, I'm fine. Yeah, I'm fine. But, things can go bad really fast if they're going bad. And in your case, I mean, I've never heard a story like yours. I in all my years, in 33 years almost, I've never heard a story like yours, Regina. And I'm glad that I've never heard a story like yours until now, honestly. But for everybody in the audience, you have to listen to her episode and hear this story because you've come so far and you've been so brave. And so, okay, final results. Like, okay, so Alexis, you said it's been 3 months. And Regina, how long has it been for you?
March 31st was when I had my revision.
Okay, so almost 6 months, right? All right. So how are you ladies liking the results? I'll start with Alexis.
Well, for me, I'll start.
Okay.
I love mine, but I'm over the moon about hers. I look at her and I look at pictures from a year ago, and then I look at her with her daughter, and it's like, oh my God, they look like the same person, except one's mini and one's big, because they much more resemble each other now. My granddaughter's very tall and thin, and now Alexis is very tall and thin. So, I mean, I don't get me wrong. I love my results. They did what I wanted. I don't have to look at myself in the mirror and see a mistake, which is what I was seeing. Every time I looked from my first surgery until Dr. Swistun revised me, it was a mistake. I wish I wouldn't have done it. It didn't really do me any good. But now I'm like really great. But when I look at Alexis, it just gives me unbelievable joy to see what she looks like, because I think on a scale, she's off the scale as far as how great her results are. So that's my take on it.
Okay, Alexis, what's your take?
I mean, I'm really, really happy with the tummy tuck and everything because, after having a baby, you never get that. It's so hard to get that flat stomach back, especially because she was 8.5 pounds. So she was really chilling in there. But, if I want to say I like my tummy tuck, I don't even know how to describe my arms. Even when I was at my best weight before this, my arms were always disproportional. I couldn't wear a lot of clothes because it would fit my torso, but I couldn't get my arms through it.
Oh.
And they've always been bigger. I told Dr. Swistun, I have not liked my arms since I was aware enough of my body to see that they looked wrong on me. And, to have them where I can put on just any shirt or any dress at the store is just I still kind of don't get it when I do it.
How did that just happen? The laws of physics have changed.
Yeah. And because, he was oh, you're going to have these scars. They're, they're relatively well hidden, but, you can see them from certain angles. And, I kept telling him, I don't really think you understand how much I hate my arms, that these scars are nothing to me compared to being able to go to a store and put on a t-shirt and not have to stretch out the arms to get my arm through it.
That's an enormous, enormous thing. And especially, I think, for somebody who's young, and like you said, you had this issue your whole life. Because I think as we women age, things get loose. And, but you kind of expect it. It's okay, but I'm getting older and my skin's flabbier. And okay, that's one thing. But to be young, and I think your mom's point earlier was really, really good. The sooner you do it, the more you can enjoy it. And that freedom of being able to put something on and have it fit. It's a big thing. That's a big thing. All right. Well, ladies, this was so much fun. So much fun. And everybody in the audience, listen to Regina's episode, and Alexis and I are going to do an episode as well. So we'll have, more detailed episodes, but I love this kind of mother-daughter duo support system. And, for anybody out there who's thinking about doing something, think about the people in your life who can help you through it, and how you can be an encouragement to each other and be that your surgery buddy. So thank you again. And we'll have links in the show notes for everybody. And we'll see you on the next episode.
Thank you for the opportunity to share.
Thank you so much.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.